Hello, Nursing 472 class. I am Erica Spillman. I'm going to tell you a little about what I've been working on this 8-week class. So I completed my practicum at St. Joseph Hospital in Breeze, Illinois. It's a small hospital, probably inpatient floor holds about 20 patients at the most, and then I work in outpatient surgery at this hospital, and we do an average of probably 12 surgeries a day, mostly colonoscopies, that type of thing, but we also do infusions in that area, and that includes like Orencia and Remicade. We give blood transfusions, we give injections of, Prolia and Neupogen, just about anything you can think of. We do not do chemo medications, though. There's a separate area in our hospital that takes care of the chemo medications. But I decided to do my practicum with those central line sites because we do see a lot of cancer patients that come in, and they're wanting us to draw blood from their lines. They want us to give a liter of fluids because their chemo has got them so run down, and they also receive blood products, platelets, and packed red blood cells. So we do see a lot of these lines in that area, which is the area that I work in the most. And I had some questions myself about the lines that we use and what am I supposed to be doing, because Hickman's were really the reason why I decided to do this practicum, because we've been seeing a lot of Hickman catheters, and we have different orders from different doctors of what to flush those lines with. And I thought, well, isn't there something out there that says what we're actually supposed to be flushing with? And the dressing changes and all that is pretty standard for most of them, but as far as the flushing part of it, always is a lot of talking amongst my coworkers, and then finding some protocols which don't usually have the flushing in there. But anyway, so after much thought, I did decide to do the PowerPoint presentation on all these types of central line catheters. Like I said, we discuss amongst ourselves, what we flush with, and is this right? Do you agree with me? And we talk amongst each other about policies regarding the flushes. So my presentation was given to my coworkers on my unit who work outpatient surgery and also infusions treatment area. So I gave that presentation. I was able to sneak about 4 or 5 of my coworkers out, along with my preceptor, came to listen to my presentation. I intended on giving the presentation at a later date to other coworkers that weren't able to make it to that day, but my father-in-law was sick, and anyway, it didn't work out. But I still plan on giving, because I know I talked to a nurse today that was confused about a certain kind of line that we use at the hospital, a PICC line. Had another discussion today, actually, about the Power PICC Solo versus the Power PICC, just the regular one. So I told her I'd bring in my paperwork and show her visuals of what each looks like and how that you can decipher one from the other. So anyway, I was able to find some evidence-based techniques for the dressing changes, proper flushing of care, and just general care for the PICC lines, the multi-lumen central lines, Hickman catheters, or the tunneled catheters, and then also portacaths, which I also discussed the portacath versus the power port, what that can be used more for the triangle shape, and they can be used for putting dye into the system for CT scans. So also another important aspect of these lines, you want to use the aseptic or sterile technique to change the dressings, and both the patient and the nurse would wear a mask. And then also the cleaning of the hub is very important with alcohol, or they now have those alcohol caps that you can use to, that has to be on for at least 5 minutes before you consider it clean. Otherwise, you're doing a 30-second kind of scrub of the hub. So, of course, we want to reduce the chances of infection the best we can when handling these types of lines. So that's important. And then also using heparin to flush the lines is also important. But different lines require different dosages. Or the tunnel ones, they require the 10 unit per mil flushes, which I found most commonly you would use 30 to 50 units of heparin to flush for most PICC lines or tunneled catheters. And then the portacaths, you would use the 100 units per milliliter, usually 500 units of heparin for the portacaths. But usually you would follow a doctor's order with anything that you would do with a central line anyway. So all in all, I think my presentation went well. I was able to give visuals of what different packages look like, of what were the supplies we're using to flush these lines. And then I also was able to have a little visual there. And then, let's see, next time I would give in a presentation, I hope to maybe concentrate more on what I'm providing rather than how everybody's staring at me and maybe giving judgment of me, because I worry about that a little too much, that maybe I should, people were more interested in what I was saying than how I looked, and that's what I have in my head when I'm up on stage, is what I look like and what they're thinking of me. So I need to get that out of my head. I know that. I was hoping to give this presentation 1 or 2 more times just to get a little more comfortable with it, because like I said, I'm not very comfortable in front of an audience. So, let's see. So my takeaway in this Nursing 472 include improved research skills. So I did learn to wheedle out some of the things I don't really need to read about in the material I was reading, because I pulled up tons and tons of articles about this. There's plenty to go by. And then also being more comfortable speaking in front of a group. And like I said, concentrate more on the material I'm giving out rather than how I look or what I'm doing, that kind of thing. And then this will change my practice in the future by being a better advocate for my patients. So hopefully I may see things on the outside, or through research I have found, like you do the Medscape classes, or I do to keep my CEUs up. And maybe if I learn something, I will make sure my coworkers are aware of like a better way to do things, new and improved way to do things. And then, so hopefully I can educate my coworkers and be more of an advocate for my patients. So I hope all in all I did okay, and I hope everybody else is doing well in the class, and good luck in the future. I hope to see most of you on Saturday at the graduation. Thank you. Bye.